Hello, all of you. Today we will be studying about hypertension, the introduction and the regulatory mechanism of blood pressure. Hypertension, that is the elevated blood pressure, is one of the leading causes of global burden of disease. It doubles the risk of cardiovascular diseases. Large segment of the hypertensive population are either untreated or inadequately treated. Depending upon the method of patient ascertainment, 80 to 95% of the patients are diagnosed as having primary or essential hypertension, and in remaining 5 to 20% of hypertensive patients, a specific underlying disorder causing the elevated blood pressure can be identified. Let us now talk about the determinants of arterial pressure. Arterial pressure is determined by cardiac output and peripheral vascular resistance. Cardiac output is determined by stroke volume and heart rate, whereas peripheral resistance is determined by vascular structure and vascular function. Let us now talk about the regulation of blood pressure. First of all, the autonomic nervous system. Arterial baroreflex is mediated by stretch sensitive sensory nerve endings in the carotid sinus and the aortic arch, and the rate of firing of these baroreceptors increases with arterial pressure, and the net effect is decrease in the sympathetic outflow and resulting in decrease in arterial pressure and heart rate. This is the primary mechanism for rapid buffering of acute fluctuation of arterial pressure that may occur during postural changes, during behavioral changes, physiologic stress, and changes in the blood pressure, blood volume. In patients with autonomic neuropathy and impaired baroreflex function, they may have extremely labile blood pressure with difficult to control episodic blood pressure spike associated with tachycardia. In both normal weight and obese individuals, hypertension often is associated with increased sympathetic outflow. So, drugs that block the sympathetic nervous system are potent antihypertensive agents. Adrenergic reflexes modulate the blood pressure over the short term, and the activities of adrenergic receptors are mediated by G protein. Based on their physiology and pharmacology, adrenergic receptors have been divided into two principal types, alpha and beta. And these alpha receptors are alpha 1, alpha 2, and beta 1, beta 2 mainly. Regulation by renin angiotensin aldosterone. It contributes to regulation of blood pressure primarily via vasoconstrictor property of angiotensin 2 and sodium retaining property of aldosterone. And this is the flow chart showing how this happens. Angiotensin is converted into angiotensin 1 with the help of renin, and this angiotensin 1 and angiotensin 2, this angiotensin 1 is then converted to angiotensin 2 in the presence of ACE kinase 2, and this angiotensin 2 then formed acts on receptors of angiotensin, and it also mediates the release of aldosterone. The ACE kinase 2, which is involved in conversion of angiotensin 1 to angiotensin 2, is also involved in the metabolism of bradykinin. It metabolizes bradykinin to inactive peptides, Let us talk about the vascular mechanism. In hypertensive patients, structural, mechanical, or functional changes may reduce the lumen diameter of small arteries and arterioles. Vascular stiffness may also represent a cause of hypertension. Then, iron transport by vascular smooth muscle cells may contribute to hypertension associated abnormalities of vascular tone and vascular growth. Then, other mechanism includes immune mechanism, inflammation, and oxidative stress. So, this was the introduction of hypertension and how the blood pressure is regulated in the body, and the rest things that are left in the hypertension we will discuss in next class. So, this was all for today's class. Thank you.